and welcome to Deuk Spine Institute's live stream. We are streaming spine surgery today. Our patient travels to us from Florida. She just had the Deuk plasma rhizotomy done for facet joint pain. If you look at the YouTube channel, you'll see we did a right C5-C6 Deuk plasma rhizotomy to destroy pain nerves that were very overactive in her neck on the right side. And we've treated her facet joint pain. Now we're going to go in and fix the herniated disc at C5-6. We're doing a left approach because most of her radicular symptoms, which is the nerve root symptoms, are on the left side. Sorry, right side, I apologize. So we're doing a left approach. Sam? Yes. Hi. All right, so if you have questions, feel free to ask them throughout this live stream of our surgery. You're going to watch the surgery from beginning to end without intermission. And we're going to show you not just the surgery, but also some very interesting videos that will help you understand what it is we're doing and why we're doing it. Now, herniated discs are the most common reason people have surgery on their spine, in their neck. And for years we had procedures like anterior cervical discectomy and fusion, which is highly invasive, and we're doing one, as a matter of fact, on a patient in 2 weeks. The other types of surgery include artificial discs, which are just as invasive as an ACDF. Big incision, bleeding, scar tissue, risk of complication. As a matter of fact, the complication rate of ACDF is 50%. This procedure we're about to do is the alternative to ACDF and artificial disc. It is a transdiscal Deuk laser disc repair. We've been doing it for 18 years. Can you guys see the face here under the drapes?
Not really, no.
No, what I'm saying is this is the
yeah,
face.
we can see the facials, yes.
She's looking up at you.
Yes.
This is the left side of her neck, Adam's apple in the middle. We're going to go in here on the left side to 5-6. Everybody agree, 5-6? Yes, sir. And we're going to repair the herniated disc without opening her up and without, with minimal risk. We've never had a complication with this surgery in 18 years. All right. If you have questions, feel free to ask. Otherwise, Henry, why don't we show the audience a video showing how is it that a herniated disc can be so painful?
Copy that.
Shot. Welcome back. So you can see from our video shot that the disc is the cause of pain through inflammation. All right, we need to get to 5-6. We're almost there. Just a little bit shot. I need an AP. Let's get an AP and see where we are. AP is a front-back x-ray. We use x-ray to navigate and localize during surgery. All right, we're a little bit off midline to the right, so I'm going to come back to the left. Go ahead. Shot. All right, so I'm going to come back, and we're going to come back to the left shot and try to center up a little bit better. Shot. Perfect. AP. I want to get another front back view. Make sure I'm in the middle. We want to be in the middle of the disc when we enter it from the front. That's perfect. Lateral. You can see the spinous processes. We're dead center. It's exactly where we want to be. So I was talking to somebody on Facebook at the Spine Surgery Support Group, which is our channel, our group on Facebook. And this poor woman was talking about how she had an ACDF surgery, not here, elsewhere. And the surgeon, she woke up with what's called the Horner's syndrome. 2, 3, 4, 5, 6. Horner's syndrome is a condition where you damage the spine to the side and it causes a permanent pupillary issue and sweat gland issue. Shot. And she was asking when it would get better, and I told her it's not going to get better. Your surgeon damaged your sympathetic trunk. 2, 3, 4. She was shocked. And I said, it's just sloppy surgery. Can you show us, Jordan, the tear in the back of this disc? Num num. Yeah, there's the tear, folks. You see the white arrow, Henry? The tear?
Yes, we can.
Yeah, very good. So that's where her symptoms are. That's where the herniation came out of. That's what we're here to clean up today so that it'll heal. And her surgeon, you know, I said, your surgeon made a mistake. She said, I had the best spine surgeon. You know, this guy's famous. And I'm like, well, I'm sorry to tell you. If they were that good, they wouldn't be doing ACDFs, right? Because this is the future. You're watching the future of spine surgery right now, and it is not ACDF. If you're a lackey for the implant company, then maybe it is ACDF, right, or artificial disc. But if you actually do what's best for the patient, you do this surgery, the Deuk laser disc repair. Shot. All right, everybody agree? 2, 3, 4, 5, 6. We are at 5, 6. Left approach. That's what we're supposed to be doing. Yes? 5, 6, left approach. It's on the board. We are doing everything right. I'm happy about that. Thank you, Jordan, for cleaning that up. Coming out with the needle and leaving the guide wire. I recognize we have some questions. I'll be happy to take them in a moment. First, I want to show you all how we're going to do this surgery with the laser. All right, welcome back. You can see from the video that the Deuk laser disc repair, we go in, we find the tear that's ripped open in the back of the disc in the wall, and we clean the tear because it's full of scar tissue and calcium and herniation. We clean all that out with the laser so that it will heal. This is a natural surgery, folks. Outpatient. This surgery takes 30 minutes. She's going to go home right afterwards. And the entire surgery is done endoscopically through a tiny 4 millimeter wide tube. No fusion, no metal. This is the future of spine surgery. You're watching it right here at Deuk Spine Institute. She is asleep, completely out with the tube down. She's under general anesthesia. It's the only way we can do this surgery. Let me see. May have to make, I think my incision is like 3.8 millimeters. Let's see if I can get this down. Shot? All right, we're down. So let's go ahead and see if I can keep it down here. Our incision is exactly 4 millimeters because it's just big enough for the tube. Shot. Now you can see the dilator has moved back a little bit. We need to basically put that back in a moment. Shot. Shot. All right, tube is on its way down. Show us the tip of the tube, Jordan. Shot. That is correct. Shot. Now the dilator is going in again. We don't want it to go in too far. Shot. Shot. I'm going to advance the dilator one more time. I don't want to do a biopsy of the disc. Shot. All right, just a little bit more. Shot. Questions for me, Henry?
Question coming from Brad on YouTube.
Brad, shot. Yeah, Brad, happy
Ask-
to take your question. Shot.
Asking, do the motor nerves that innervate the cervical multifidus muscles have a specific name, or are they just called the motor nerves?
Bradley, you can name them whatever you want, my friend. You can call them motor nerves to the multifidus muscle. All right. Next question.
At this moment, no current questions.
Wonderful. You can see we're on the left side of her neck. We have our tube in. I'm going to go check it out. Hopefully we haven't moved it back at all. If you have questions, feel free to ask. We don't have the 30 causes of neck pain yet, do we?
No, not yet. I am currently in the works of that. It will be released hopefully sometime next week.
Perfect. Let's get it done.
Copy that.
All right. Well, here we are. Too much light in my face, Luis. Take care of that, please. That is really good right there, actually. Thank you. Do I need to adjust the focus, or does it autofocus?
Should be autofocusing.
Really? It's pretty damn good. That image is nice. Sorry, what were you going to say?
I wanted to see if you wanted me to increase.
Sure. Yeah, you can increase the size.
You can just press the left arrow.
Look at that herniation right there, guys. No, I don't want to fuck around with the scope, okay? You either do it for me, or we just keep going. It's a bit over bright. I need to bring the brightness down. These are all pieces of herniation, folks, coming out. See the blue things?
Yes, we do.
Those are herniations. It's a little too bright. How do we bring the brightness down?
I'll bring it. If you're okay with me.
I want to bring one click down. It's a bit, we call it overexposed. All right. There's another piece of herniation. Do you guys see that?
Yes, we do.
So, really? It requires all that just to,
Yes, sir.
why is that?
If I did it from the camera head, we could bring it down from there, but I'm just trying to.
Oh, interesting. So the surgeon has to stop operating in order to make the adjustment, pretty much. Yes?
Essentially, but
Yeah.
we can do a preset setting for this type of procedure where it drops the brightness down.
But we don't know. That's the problem. Every patient's different. Yeah. Every patient's a little different. Okay, I'm going to flip it to the other side. All right, any questions, Henry?
Yes, we have another question coming from Brad once more on YouTube.
Sure, Brad.
Asking, does Deuk Spine offer physical therapy?
Deuk Spine does not provide therapy ourselves. We do not, no. We're not a therapy center. We don't provide chiropractic therapy or physical therapy or occupational therapy. We only provide consultative services, figure out what's wrong, like why do you have back pain, why do you have neck pain, and then treatments that are surgical basically, and we do some medication management, but only for our patients that are having surgery. We discourage the use of medication strongly. Medicine has no real role in the treatment of chronic pain. Chronic pain should be fixed, should be resolved with proper treatment, which is usually going to be surgical, this type of surgery, for example, if it's spine. So let's talk about that. We have done an analysis on our patients that have presented with chronic neck pain and chronic back pain. I honestly think this is a better image. I don't know if Luis has just picked the best scopes, but this image looks better to me. Huh?
Can you ask the viewer?
Oh, the
See if
viewers.
they changes
Ah.
or something?
Yeah, but I don't know. We'd have to have regular viewers, you know? I mean, Henry thinks it's better, and that's
Much
that's what-
better. Yeah.
That's what matters to me. The question's going to be the cost. And also, I'm not happy about the fact that I have to stop operating to make an adjustment on the brightness. You know, I don't like that. Is it really autofocus?
Yes,
Is-
okay, I did talk to an engineer, so he said that we do, our camera components on the inside have the, I'm gonna read you the exact response, but they have the, motor box and the gear control, which is what controls the auto exposure, and we do have that capability automatically inside our camera system. But,
So you're saying we could set it to a level and hope that the computer does it every time? But what if,
But
the auto,
there's a,
so
there's
the
a,
auto exposure happens automatically depending on what type of light is filtering in through the prism that I
Uh-huh.
was talking about earlier.
yeah,
So that's automatically happening, and then all of your like fine-tuning details, like your brightness,
Yeah.
contrast, things like that, we can kind of mess with this.
so maybe we do this again with an engineer to help us.
As far as like adjusting,
Yeah, because this is overexposed right now.
yes,
Huh?
I can adjust that from the
Yeah,
screen,
the
and
brightness,
then
the brightness, that's what.
No, but I want to know, I want to see it optimized. If I'm going to spend the money on a new camera system, I want to know what its full potential.
yes, my engineers come with me to do a full install.
No, we're not talking about an install. We're talking about a demo. We're talking about, I want to see it working before I buy it.
Yes,
Yeah.
I'm with you.
Like, this is too bright. It's overexposed. It's not horrible. It's workable,
Yes.
but it's not optimal. Huh? What? These are all pieces of herniation, by the way. All right, Henry, where were we? Ah,
We have a couple questions. This
Sure.
next one coming from Brad once more on YouTube asking, have you ever treated patients with Ehlers-Danlos syndrome?
yes, I've treated patients with Ehlers-Danlos syndrome. Absolutely. Marfan's, Ehlers-Danlos, all the above. Look at this piece of herniation I just popped out. Can you guys see this, Henry?
Yes, we can.
It's about 4 millimeters, you know, but it's only one of several. And I want you to look at it right here because it's quite interesting. You can see the blue dye which stains nucleus pulposus, nuclear material, and you can see the kind of reddish brown stuff which is the scar tissue and inflammation. So you kind of have a mixture of different types of tissue there. But you have a reactive tissue, your body attacking it, causing inflammation and scarring, and then you have the actual disc hernia. Dr. B, I'm sorry, we have about 5 minutes max. 5 minutes.
Looking good here.
Yeah, 5 minutes. Keep the questions coming if you like.
Next question coming from Dr. Ahmed Mar on YouTube
Yes, Dr. Ahmed Mar, nice to have you with us today.
saying, hello, I want to ask Dr. Deuk about the 2 medications he usually injects at the end of every case. Thank you in advance.
Oh, sure. So we're not really injecting a medicine. We're injecting, what do you call it? Betadine. And we use irrigation to clean it out. The only medicine we put at the end that we leave is a little bit of Depomedrol. Yeah, a little Depomedrol. What is it, Kenalog or Depo? A little Kenalog, sorry. As a little steroid to help with some of the inflammation from the surgery itself.
Next question coming from Teresa on Facebook
All right, we'll take Teresa's question.
saying, hello, everyone. Dr. Deuk, can mild kyphosis of the cervical spine cause pain in the neck?
Can mild kyphosis cause pain in the neck? No, it cannot. As a matter of fact, I don't know where you got your diagnosis of kyphosis, but if you look at an MRI scan and you diagnose kyphosis, it's usually not accurate because of the way you're laying in the MRI scanner. You're laying on your back, you're looking up, you have a pillow under your head. The pillow is putting your spine into mild kyphosis while you're laying there. Now, the other thing that causes mild kyphosis is muscle spasms. Typically, if you're having pain, your muscles are going to tighten up, like your sternocleidomastoid and your strap muscles, and they're going to put you into a slight mild kyphosis, okay? That doesn't mean you have kyphosis, and certainly not the cause of your pain. Even if you had moderate kyphosis and potentially even Well, I'd say mild and moderate kyphosis, they do not cause comes from, and I apologize, I started to tell you guys about this and I got distracted with the light. We did a study on our patients. Turns out that 90% of chronic neck pain lasting more than 6 weeks, comes from disc injuries. This exact same type of disc injury, whether it's a annular tear with a disc bulge or degenerative disc disease, disc herniation, protrusion, extrusion, slip disc, ruptured disc, doesn't matter. Any kind of a disc injury is the reason people have pain 90% of the time. So fix the disc injury, you fix their pain. The other 10% of chronic neck pain comes from the facet joints, F-A-C-E-T, facet joints. So facet joint syndrome. And what is the facet joint? It's a small joint located behind the disc. Every disc in your neck, you have 2 facet joints, one left, one right. And it turns out those joints, when they get injured at the same time your disc got injured, they actually get arthritis over time, inflammation. And that arthritis then causes pain in the joint, okay? And Henry, did you show that video, the Deuk plasma rhizotomy cervical?
No, not yet.
Why don't we do that?
Copy that.
Facet joint injury is a common cause of chronic neck pain. The inflamed facet capsule tear generates pain signals. The best treatment for facet joint pain is the Deuk plasma rhizotomy. The inflamed facet joint pain nerves are destroyed. The advantages with the Deuk plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
All right, welcome back. You saw how we treat facet joint pain in the neck. By the way, this is the first medicine, it's bacitracin. We used to use in surgery irrigation that contained, bacitracin. We used to contain bacitracin. It's betadine now. We used to use bacitracin, but then I guess there were some, not with us, but somewhere nationally, internationally, there were some reports of nerve toxicity with intramuscular bacitracin. And so it was pretty much wiped off the market. And I used it for 20 years in my residency training, and surgeons used it even before that. Bacitracin, polymyxin in their irrigation. Now I just use a little bit of betadine at the end. Here you go. Yeah, highly diluted. Yeah, do not use full strength betadine. It'd be very bad. So we're done with her surgery, and I have my finger on the incision. I'm just holding pressure. Sometimes you get a nick on a vein and the vein wants to bleed. Other times you don't. It's a 50-50. But if you get a nicked vein, all you got to do is hold pressure for 4 minutes or less and the bleeding stops. We've never had an arterial injury, no carotid injury, no jugular injury, no venous, no sympathetic trunk, no vagus nerve. I mean, we never had any complication from the surgery. Our average blood loss is probably 1 cc. And this patient is going to go home in 30 minutes. 30 minutes going home. All right, let's take a look. The incision is 4 millimeters. You guys have a ruler here. Let's just see if it's bleeding or not. I don't see any bleeding. So it looks like she had a meeting with a vampire that had one tooth. You guys see this?
Yes, we do.
Can you see that 4 millimeter incision?
Yes, sir.
All right, 4 millimeters. Beautiful, no blood, no metal, no fusion, no biologics, no cadaver bone or stem cells or garbage that all these other surgeons push on patients that don't need it. This is the best surgery in the world for a disc problem, and it's natural. So I'll be there in a moment to answer your questions. Type them up. I'm going to come talk to you, and we're going to talk about insurance today. All right, we're going to talk for a few minutes about insurance payments for the surgery and whether insurance covers it or not. I'll answer some questions about insurance if you have them, and ask them. Scope use is a 4. Thank you, buddy. I'm Dr. Deuk Majan, CEO and founder of Deuk Spine Institute, Deuk Joint Institute. I'm here with our patient from
Louisiana.
That's right. I had to have him say it. It sounds better when he says it. Why did you come all the way to Florida to the Deuk Spine Institute?
Well, about 3 months ago, I was scheduled for a cervical disc fusion in Shreveport, Louisiana. Had done all the pre-op stuff, was scheduled within 2 weeks to do the surgery, got to work and started doing some research. The more I read about what they were going to do with the fusion, people having trouble with it down the road, above and below the fusion, decided there had to be a better option. So that's when I found Dr. Deuk and his team and started watching some of his videos. Pretty impressive.
And you're a YouTube guy, you were
Yes,
telling
sir.
me, so you found us on YouTube. And what did you think?
Well, our first impression was any doctor that will put his livelihood live on YouTube, showing all of his surgeries, putting it out there, believes in what he's doing. That's not many doctors would do that.
Not just because of that, but because, afraid of complications, which, praise God, we haven't had a complication. We've been doing it now for 17 years. I want people to know there's a safer, better way to take care of their problem other than metal, fusion, stimulators. That's really the message there. You got that message loud and clear.
I did. My surgery was less than 24 hours ago. So far, the tingling, numbing going down my arm is non-existent. It's went away where it was there constantly all the time before. So hopefully this continues on.
Oh, it's gonna continue on. Our results are permanent with the laser surgery. And you can see your tiny little incision right there. It's a 4 millimeter. You can see we went in with a little tube into your disc. I was able to get both discs fixed. You had a lot of herniations in there. Something a lot of people don't understand. They think that a herniation is one piece, but it's about 30 pieces on average. And you had about 30 pieces in each of your discs. They were hard to get to, but we got it done. And I was very happy with the end results. We got all the pressure off the nerves, and we fixed the tear in the back of the disc. Less than 24 hours, here you are. You're doing fantastic. Now, what did your wife think about you coming down here to Florida? Was she supportive?
She was. This problem had been going on for many years. Started out on my right side years ago and had some stuff fixing that, but she knew the problem I was having. I'm very active. I'm a scuba diver, a motocross racer, do a lot of active sports, and she said, we've got to get this fixed. I'm too active still to actually quit all this. I don't want to quit, so this fusion just seemed like it was going to limit my options on doing things. So that's why we come down here. She was very supportive, and we decided to sign up and come on down.
What do you have to say to your insurance company? What do you want them to do?
I sure hope they pay, because I know they would have paid on the fusion deal, but why they would not pay on this, I don't know why, because results are immediate.
And no narcotics?
No, haven't taken a pain pill, haven't taken anything, nothing. Slept like a baby last night.
That's right. And after fusions, a lot of patients end up in pain management. They're getting shots, they're getting pills.
They can't talk, their esophagus is all tore up from them pushing it out of the way.
That's right.
And I have none of that.
Yeah, our patients don't go to pain management because they don't need it. Anything else you want to say to your fans out there?
If you are considering having some type of neck or back surgery, I think you ought to look at Dr. Deuk and his group, because they got a great facility down here, very accommodating. They'll help you with travel, whatever you need. We flew down Sunday. Today's Wednesday, and we're going to stay till Sunday. Enjoy a little bit of Space Coast. Hopefully get to see a rocket launch here on Friday morning.
That's right. You can see the rocket launches from here and feel them. All right, sir. It's a pleasure.
Thank you, sir.
My pleasure. You have a great day.
Okay.
Let's get you guys out of here. You got better things to do than to sit in a doctor's
Exactly.
office. And good morning, I'm Dr. R. Deuk Majan, CEO and founder of the Deuk Spine Institute. I'm here with one of my patients who's traveled far to come to Deuk Spine Institute, all the way from Michigan. What brought you from Michigan to Florida?
I was scheduled for fusion to have just my one disc, C5-C6 fused. I'd had disc herniation before in my lower back, had it done. I didn't want to have to go through that again, so I did some research. Found you had a good record. Your history is impeccable, so I decided to come down here and have it done.
Well, you didn't have a fusion, though. You had something else done.
Yeah, I'm sorry. So instead of fusion, instead of going through and the complications and risk of fusion, lack of mobility, I wanted to have laser. I talked to somebody in Mexico that had laser surgery, and she said it worked great. So I thought I'd pursue that avenue, and that's when I kept Googling and searching and trying to find the right place. Some places had bad references. You had impeccable record, so this is why I came here, and I'm glad I did.
Yeah, so you were recommended for fusion by another doctor, and let's talk about that for a moment. They were going to fuse one disc, right? Number 5-6?
Correct.
Now, if you go to your surgery video here, you could see that we made a tiny 1/4 inch, 4mm incision. And we fixed 2 discs, not 1, but 2. And it turned out that the disc that you were not going to have fused was actually the worst one. It was the one that was causing the vast majority of your symptoms. And the reason I'm talking about this is it's a common problem. It comes down to being misdiagnosed. And misdiagnosis happens all the time, all over the world with spine problems. And that's what we're trying to fix, is not having patients get the wrong diagnosis, because the wrong diagnosis will lead to the wrong treatment, because treatments are always based on diagnosis. So if your diagnosis is C5-6 disc, the treatment will be fusion of the C5-6, but that's wrong because you had 2 discs that were problematic. We fixed both. You could see in that video, we were taking out lots of little chunks of herniation out of your C6-7 disc. Definitely needed to be done. How do you feel today?
I feel great.
Yeah, do you still have the same neck pain you had when you came here?
No, my wife can already tell that my shoulders are relaxed. My neck, I feel great. Feel very comfortable.
And you had your surgery just 24 hours ago.
Yesterday morning.
Yep, and you can see you have a tiny 4mm incision with a Band-Aid. No metal, no fusion, no narcotic painkillers after surgery. We didn't give you opioids, so that's another plus to the Deuk laser disc repair.
I agree.
Yeah, you don't need to be on powerful painkillers. You're back on your feet already, walking around, not in the hospital.
Yep, great. I'm glad I had a guardian angel looking after me.
You did have a guardian angel, and you're welcome. We enjoy helping people like you have successful spine surgeries. Is there anything else you want to tell your fans out there?
Basically, if you need the surgery, if you're having complications, neck, back, definitely come here. I don't care what it costs you for travel or whatever. You can't, it's worth, priceless.
I agree with you. It is priceless to get out of pain and have no complications. What lovely testimonials. And I just wanted to get to your questions. We do have another 3 surgeries today. And as I said, this was our first live stream for today because we had 2 patients. One of them did not want to be live streamed. He was a big case in the morning. And the second one, we're in room 2, so we don't have the video equipment in room 2. We have the video equipment in room 3. Oh, when I say room, I mean operating room. So I'm abbreviating. So we could not live stream that one. But now we're back. We got a patient from Hawaii next. He is here for 2 procedures. He's having his left SI joint Deuk plasma rhizotomy for sacroiliac joint pain, one of the most common causes of back pain. He's also having his neck operated on, which you'll see on Thursday. We're not going to be able to do the SI joint because that's going to be in room 2. We don't have video cameras in room 2. We have video cameras in room 3. So the next case you're going to watch is going to be a 3-level lumbar Deuk laser disc repair. Our patient is from Cocoa Beach, Florida. She's a local, and she has 3 discs that are painful in her lower back. We're going to fix all 3. That's going to be the next broadcast you all see in about 40 minutes. Until then, we have some folks. We get a lot of flack online, and it really is frustrating for me as the founder, CEO, pioneer of these treatments to sit there and listen to people who, honestly, we do these free MRI reviews, we help people, we give them a diagnosis, we tell them what's wrong and how to fix it. We're giving them, for the first time in their entire life, of suffering with pain, could be 10, 20 years suffering in pain. Nobody's ever fixed them, nobody's ever given them the right diagnosis. I give it to them for free in a 10-minute video conference. And then they go online and they post something on Google about how we charge too much money for the surgery and how Dr. Deuk Majin is greedy. So here's the facts. Number one, I don't get that money. It goes to pay our bills. Our bills are massive. Running a healthcare facility like a hospital, mini hospital, it's expensive. Probably $700,000 to $800,000 a month. That's what we have to pay. That money has to come from somewhere, and it's either coming from the patient's pockets or insurance companies. There is no donors. We don't get money from Mark Zuckerberg or Bill Gates. They've never dropped us a few million. Here's a few million, go take care of some patients. Okay, it doesn't happen. We don't get money from our government. The government steals the money from us. We don't get anything, as a matter of fact. I was just talking today about how the television in the operating room, I tried to buy it at Costco, and it was $500 so I could see the surgery, and I was told by the government agent that you can't have a $500 TV, you need to go buy a $10,000 TV because it's medical grade. Well, that medical grade TV is no different than the $500 TV. It's the same TV, except it just has a sticker on it that says UL listed, so it becomes a medical grade TV. $10,000 versus $500. I don't make this shit up, it's real. So the cost of running this place is astronomical. We have to get astronomical amounts of money from our patients and the insurance companies because running this place is astronomical. So we get a lot of flack online about people not happy about paying out of pocket for surgery. Sorry, that's not our fault your insurance won't pay. But that said, this is really about the times that insurance does pay. So I brought proof today. We just got another payment from Blue Cross Blue Shield on a patient who had the laser surgery. All right, Henry, tell me if these are centered. Now, I've taken the patient's information out. There is no patient information here. I've redacted everything. All you're going to see are 2 codes, the 22899, and you're going to see the payment from Florida Blue on the first one, okay? Can you see this?
A little more back, just a little more.
All right,
Yeah.
right there is perfect, right? Florida Blue in the top,
Let's take it back just a little, just to get rid of the blur. Perfect.
Florida Blue in the top. Zoom in. There's a payment right there for $78,000, okay?
Yes.
Paid for Deuk laser disc repair by Blue Cross Blue Shield. Here's another one. Florida Blue, okay, once
Yeah,
again,
perfect.
for another patient. They paid $148,000, all right? So when I see people complaining about $30,000, I get it. I feel for you. I really do. We don't want your money. We want the insurance company to pay for your surgery. But the reality is if the insurance company won't pay, you got to pay, okay? Here's another payment from Blue Cross. Okay, Florida Blue, this is $71,000. Why am I showing you these payments for our surgery? Because people always out there lying to you saying insurance won't pay for the surgery. Insurance will pay for the surgery. The problem is it's unpredictable whether they're going to pay or not. And the majority of the time they don't pay. We have to fight them. And even after we fight them with appeals and letters and petitions, we do everything we're supposed to do, they still don't pay. So it's not consistent, unfortunately. They pay about 5% of the time. Here's another payment. Again, Florida Blue. Can you see that?
Yeah, perfect.
$91,760, okay? Here's another one, Florida Blue. These are electronic fund transfer receipts, by the way, in case you're wondering what am I showing you. They're 77,000. And finally, here's another one for 116,000, okay? Point is, folks, insurance does pay, they don't pay consistently. We cannot run a business not knowing if we're going to get paid for the surgery that we're spending tens of thousands of dollars to fund. I'm sorry, I wish it were better, but this is today's healthcare in America. Insurance companies do whatever they want, they run the show, they've got control of all the purse strings, you pay them every month, they decide if they're going to pay the doctor and hospital or not. I'm going to tell you a staggering number. There are 1 million plus denials of payment every day in the United States for medical services that doctors prescribe or doctors perform. Okay, so 1 million a day. Think about that. 1 million a day. That's you going to the doctor, doctor orders a lab, the insurance company says, no, we're not paying for the lab. Or you get the lab done, they bill the insurance doesn't pay. There is really, realistically, over 2 million denials of payment a day by insurance companies. I said 1 million just to be conservative, but 2 million easy a day. So you're all living in your fucking dream world where you think your insurance is so great, it covers everything. It doesn't. It's screwing the doctors and the hospitals, and the hospitals are going out of business. Stewart Healthcare just claimed bankruptcy 3 weeks ago. Stewart, one of the largest hospital chains in America, it's been around for a long time, bankrupt because they're not getting enough money from the insurance companies because they're denying everything. 30 years ago, insurance companies didn't deny anything. They just paid the bills like they're supposed to. Then over the last 30 years, denials have gone up because nobody stops them. The patients are unaware of the denials. They get the service they need. They get the care they need. Well, guess what? Not at Deuk Spine. We're not going to do your service, bill your insurance, get denied, and then I'm the one who's paying your bill. I can't afford it. We'll go out of business overnight. It's too expensive. So we make people pay up front. I'm sorry, until you get your insurance paying properly every single time, that's what we have to do. Okay? But evidence that insurance does pay. Okay? It just doesn't pay all the time. And it's unfortunately infrequent that they do pay. All right, we'll take questions.
Alrighty.
Now that I've poked the beehive and hornet's nest and shaken it up, and the hornets are going around, let's take some questions.
All right, we got a good amount. This first one coming from George on YouTube.
Hello, George on YouTube. Welcome.
Asking, can you show us also the axial view of the MRI? You always show only sagittal.
Great question, George. I will talk to Henry about that. It's not a bad idea.
That is not a bad idea.
So can we put two images next to each other, or take a screenshot of the axial and sagittal, get the right ones?
Yeah, and then have them collab together. I can do that.
All right, we're going to try to do that,
That
George.
was-
Thanks for the suggestion. I think it's fair. The axial view, for those of you who don't know, the sagittal view is I'm slicing like this through the cervical spine or lumbar spine, kind of going from side to side while the patient's looking forward, and then looking in there at the spine from the side view. The axial view is like chopping it a different way, but looking through the disc, seeing the herniation on the axial view. We'll try to do that for you. Thanks for the advice.
Yeah, seriously. Next one coming from Brad once more on YouTube,
Hi, Brad.
asking why is it important to close with the fascia at the time of closure in posterior cervical surgeries?
So Brad's asking, why is it important to close the fascia when you do a posterior cervical surgery? Well, first of all, the fascia does a couple of things. One, for those of you who don't know what the fascia is, if you've ever gone to the supermarket and bought a piece of meat from the butcher over there, if you notice there's this red meat and then on top of it there's this white or yellow like tough material that you really don't want that comes with the meat, that's fascia. Fascia is tough connective tissue. It's in every animal out there, and it wraps around muscles. And there's a fascial layer in the back of the neck that, is continuous. The reason why we have to sew the fascia together is it prevents infection from going from superficial to deep. It's a barrier to infection, which is good. You want a barrier to infection. If you had spine surgery, you don't want the infection getting to the spine. And number two, If you get a spinal fluid leak, which I don't get, but if you're a sloppy surgeon, you get a spinal fluid leak, then that keeps the spinal fluid from leaking out too much and giving you a big pseudomeningocele. The other reason is you can't sew muscle, it just tears, so you got to sew fascia. And that kind of allows you to get the tension off the skin edges. So there's a lot of reasons to sew the fascia in a posterior cervical. They're all good reasons, and I always do it when I'm doing open surgery.
Next question coming from Snap on Ron
Snap on Ron.
on YouTube,
Welcome.
asking how long will the recovery take from a 3 herniated disc repair by the DLDR? When will the pain of that surgery go away? I mean the surgery pain, not the pain patients arrive with.
So great question. The question is, if you have 3 discs repaired with this surgery, when does the pain from the surgery go away? It depends on if you're having it done in your neck or your lower back. So I'm assuming you're talking about the neck. If we do 3 discs in the neck, the pain from the surgery should be gone by the next day. If there's pain after that, then it's not coming from the discs that we operated on. It's probably not coming from the surgery. It may be coming from the facet joints, which is the other cause of neck pain that's very common. If you look at our original publication in PubMed, the Deuk laser disc repair is a safe and effective treatment for symptomatic cervical disc disease. That's the title in PubMed. You'll see that 25% of our patients that had the laser on the disc also had facet pain, and we had to treat their facet pain. And unfortunately for some patients, they perceive the facet pain to be, oh, my disc pain never went away. But actually it's a different problem. It's their facet joint. And just to show you what I'm talking about, folks, here is a model of the cervical spine. And these are bones. The discs are between there. There's the ligament right there. And there's the back of the spine. And don't pay any attention to the screws and rods. But basically, your facet joint is this joint right here. Can you see that, Henry?
Yes, we can. Yeah.
The disc joint is right there. If I fix your disc, okay, I fix the disc, I'm not fixing your facet. The facet you have to go through the back of the spine to fix. If I fix your disc but your facet is hurting, it feels like it's in the same place. It's literally a centimeter away from each other, like 10 millimeters. It's very close. It's like that far from each other. So it's hard for the patients to tell the difference. But it is what it is. I mean, you know, some people have both disc pain and facet pain.
Next question coming from Teresa, once more on Facebook, asking, Dr. Deuk, do you take community care with the VA?
So Teresa's asking if we take community care with the VA. Teresa, the last time we took VA patients with community care, we did about 10 surgeries, and the VA never paid us. So we ended up eating the cost, and it was a lot of money. We're just tired of getting burned by the VA. And it's not the VA and the vets. It's horrible that the vets have to deal with this. It's actually the government hiring an insurance company to manage benefits. What that means is when you take care of a VA patient, a veteran, all right, as a doctor, you bill the VA. The VA, when they don't pay you, it's not the VA not really paying you. It's the person they hired to pay me. And that is usually a subsidiary of Blue Cross, United Healthcare, Cigna, take your choice, all right? And in this case, it's called Community Care. It's really a company that the VA has hired to pay off their debts, their medical debts. And that company is the one that denies payment and doesn't pay. And then you get angry with them, but the VA has created a shield or a barrier between the VA, the patient, and then the provider. And that shield is the one who's denying the benefit. They're saying, we're not paying. Whatever, your treatment is not necessary or it's experimental. So to answer your question, I'm sorry. At this time, we are not accepting that because they don't pay. And the patients always get their surgery. They're happy. They go home. Their lives are better, which is wonderful. That's why we're here. We want to do that. But we can't do it and not get paid because then I'm paying the bill. Me personally. I back every financial obligation of this company personally. It is horrible. I hate it. I hate being on the hook for everything. I have nightmares at night about it. But the reality is that if I don't do it, nobody else will do it. There is no Mark Zuckerberg, Bill Gates, Elon Musk backing us. There's no venture capital, Wall Street, the bull. There's no money, right? I have to borrow every dollar to pay for people's surgery, and if we don't get paid, I just lost that money. My wife will kick my ass at home. She will, by the way. She will.
Yes.
Right?
Yeah.
Jewish guilt. We all know what Jewish guilt is. Like, Jewish guilt is thick, right? What Jewish guilt means is if you do something you're not supposed to do, then your Jewish mother or aunt, you know, they ride you about it for a long time. And every time they see you, they mention it. And everything you do, they bring it back up. And it doesn't matter how good you are, how good you do. You can go out and do yard work for an entire week, and they're still going to bring it up, okay, whatever you did. You understand what I'm saying? For months. Now, my wife is Korean, South Korean, and I will tell you something. I thought Jewish guilt was bad. Freaking Korean guilt is 10 times worse. I would take Jewish guilt any day over Korean guilt. It's horrible. I mean, literally, 10 years later, she's bringing up stuff that I did 10 years ago, and it's just agonizing. So, my point is, I cannot pay for people's surgery. My wife would just guilt me to death, and she loves the fact that I help people. Trust me, this is what we do. We love it. We're here for that. I could have retired many years ago. I don't. I love helping people, but I can't pay for the surgery. So, I'm sorry. I wish I could operate on every veteran. There's millions of vets that need this surgery, but the VA is a scamming organization. Okay, it's a scamming organization. I used to work at the VA in Gainesville. I think it was the busiest VA hospital in all Florida. We had the most vets. We tried to get the VA to take care of more vets. We went to the administration when I was a neurosurgeon there. We said, hey, the clinic only has 10 spots for 10 patients. We could see 30. We want to help more vets. We want them in here. We want to diagnose them. We want to fix them. And the administration said, no, we're not opening your clinic. We're not giving you any more spots. Sorry. Basically, the VA is rationing care for the veterans, and this is how they do it. They do it through many different ways. One of the ways they do it, and I know all the ways they do it, by the way, I was there for years. One of the ways they do it is by not paying the doctors and hospitals that take care of them outside of the VA system. All right, they used to do it. They used to pay Medicare rates. Now they pay nothing. They just deny it. And the doctors and hospitals aren't stupid. We can't afford to keep taking care of the vets and not getting paid. I'm sorry. That is the God's honest truth. If it was any different, then I'd tell you.
Next question. This is a reiteration from Snap-on Ron saying that it was for his lower back, not neck area, the L5, L1,
Sure.
and L4. Yeah.
So for the three level DLDR?
Yes.
Oh, okay. But Snap-on Ron, I think your question was geared towards what's
the 3 herniated.
Yeah, what's the recovery time for the lower back DLDR? It's literally the pain from surgery will be gone by the next day in 90% of patients. 90%. 90% of our patients walk in here the next morning, their smiles, they're hugging, they're crying, they're very happy. 10% still have some pain, either from the disc or the surgery. And I'll be honest with you, those 10%, did you see maybe a little bit of bleeding? Well, there wasn't very much bleeding at all. But there are some patients that have blood, they take blood thinners, they take aspirin, they take some type of plant, you know, they drink Red Bulls, whatever, and their platelets don't bind, and they end up doing a little bit of bleeding during the surgery in the muscle. Well, that blood's got to break down over time. So there's that blood in the muscle, your body will process it, and part of that processing, it takes weeks. They're going to have pain while the blood that's in the muscle is being processed, okay? It's not out of my control, but it is part of the surgery, and that's post-operative pain.
Next question coming from Milagros.
Milagros, welcome.
On YouTube.
Thanks for being here.
Asking, I have congenital scoliosis, and I've had 4 scoliosis surgeries and 2 L&Ds.
Labor and delivery.
Okay, my neck is fused from birth. Do you do scoliosis surgeries?
So, Milagros, I'm Dr. Dumajian. Yes, I do scoliosis surgeries, absolutely. I used to do a lot of scoliosis surgery. I've cut back. Milagros, the best advice I can give you is, are you in pain? If the answer is yes, use our free MRI review process. It's literally free. You don't pay any money, and I will review one of your MRIs for one of your body parts, lumbar, cervical, thoracic, you pick, whatever bothers you the most, and I will diagnose your source of pain, and we can fix it without doing scoliosis surgery. I can almost guarantee you that. All right? Nice. I hope to meet you, and I hope to figure out what's wrong.
This next one, this is a compilation of multiple people saying that the image quality was great and all, and then the question coming from SportsMed Maven on YouTube saying, great image quality, what system is this?
Ah.
Yeah. So,
All right,
thank you.
Maven. Well, thank you everybody for the feedback. It's interesting. We are testing a new camera today for the first time in 18 years. And it's supposed to be a 4K camera with a 4K chip and processor, and I wasn't sure you guys would notice a difference, but apparently maybe you are. I guess it sounds like everybody likes it.
A few of them say, yeah.
So the name of the camera system is called CONMED, C-O-N-M-E-D, Linvatec, L-I-N-V-A-T-E-C. What is tech? T-K or T-H?
T-E-C-H.
T-E-C-H. So CONMED Limitech, they produce cameras, systems for endoscopy, which is what we're doing, right? And yeah, we tried out a new one, their latest model. So it's good to know that you guys like it. I'm afraid to hear the price tag. I'm sure it's tens of thousands of dollars. I don't know if I can buy it right now, but we'll look at the price and see.
Next question coming from Brad once more on YouTube asking, is the fascia in the posterior neck directly midline, and can you see the damage to the fascia in any imaging?
So Brad, the fascia in the back of the neck is you can go to what's called Netter's, N-E-T-T-E-R-S anatomy, Netter's anatomy, N-E-T-T-E-R-S anatomy, and you'll see pictures of it. Netter's is what we use in medical school to learn about the body parts. The fascia in the back of the neck is across the entire back of the neck. It literally runs from side to side. It's on top of the muscle, meaning it's close to the skin. The skin's here. If you cut down below the skin, you get the fat, and then under the fat, once you peel the fat back, you have this white membrane that's really tough. That's the fascia. It's called cervical thoracic fascia. It starts at the bottom of the skull, attaches to the skull, and runs all the way down into the thoracic spine, all the way down to the lumbar spine. If you go to Netter's, you'll see it. And can you see it on MRI if there's a cut in the fascia? Sure. Yeah, you can, as long as the cut's big enough. If it's a tiny cut, no. If it's a big cut, yes. I'd say if it's 2 centimeters or bigger, you'll see it.
This next one is from the Classic Car Nut on YouTube asking, hey Dr. Deuk, I asked you about flossing to help my lumbar reticulopathy. Can you do the floss for the audience again?
Oh, man.
Great work.
My floss is horrible. So you asked me to floss the other day. I'd be happy to do it again. I am a terrible singer. I am a terrible dancer. God did not give me those skills. I suck. All right? I'm a good soccer player, but I'm a good surgeon, but I suck at those things. I'll do it, but it's embarrassing at how bad my flossing is, okay? But I'll do it for you anyway.
Yeah.
I don't even know how to floss.
It's kind of, here, I'll do it with you off screen. So it's
I
kind of like,
don't understand this.
Yeah,
So what do you do here?
so yeah, you kind of have both your arms out this way, you kind of do this.
But which way am I moving my hips?
You're moving the hips kind of like opposite directions. So
So if I move my hands here, should my hips go this way?
yeah, pretty much, yes. So you
Alright.
go like this, that.
Wait, what did you just do?
So I pretty much just
Like
switched the
this?
arms, going like that too. Yeah. It
All right,
is
here's
so
my
weird.
flossing.
Yeah, that's perfect. Yeah. Yes, that's it actually. That's
All right.
actually it.
Thank you, Henry, for
Yes.
teaching me. There you go. You got Dr. Deuk flossing. All right.
Oh, that was a delay.
Sorry if I hurt your eyes or offended anybody out there, but I suck at dancing. I'm the first person to tell you, and singing. My wife can't stand my voice. All right. What else do we got?
Next question. This is Snap on Ron just wanted a reiteration of their with the lumbar.
Got it.
Like how long it would take for the pain, for the surgery pain.
Yeah, Snap on Ron. The surgery pain usually 24 to, let's say, 72 hours.
Yeah. Perfect. And then last but not least, coming from Truth Be Told on YouTube, asking, what can be done for spinal epidural lipomatosis that causes stenosis in the lower back?
Okay, thank you for asking. Yeah, spinal epidural lipomatosis. It's interesting. The first time I ever heard of that was back in residency, and I saw an MRI, and the patient had a lot of fat in the epidural space. And here's the problem. I'll just be honest with you. I'm not convinced, after 27 years of treating people's back pain and spine, I'm not convinced that that causes any symptoms. So what are we talking about, folks? Let me show you. Spinal epidural lipomatosis. What is it? It's basically, lipomatosis just means fat, okay? We all have fat. Some of us more than others. I have a lot. I'm getting rid of some. But anyway, this is the spine, right? The lower back. There's bones, the disc. Here's a nerve coming out. There's a space in here. You guys see that space right there?
Yes.
Around the nerves, around the membrane called the dura. This is the epidural space. Some people have a lot of fat in that area, okay? It's called spinal epidural lipomatosis. But here's the thing. I honestly don't believe it causes symptoms. I don't. Could it be that it does in your case? Maybe. Could I figure out if it does? Maybe. I probably could. I wouldn't do anything right now. I don't know if you're a heavy person. If you're overweight, maybe try losing some weight. See if it goes away. But it shouldn't cause any symptoms. I think it's just a finding on MRI. Now, if you're having back pain, I guarantee you 100% it is not causing your back pain. Listen to me again. If you're having back pain, I guarantee you 100% spinal epidural lipomatosis does not cause back pain, ever. If anything, it would cause leg symptoms, and I honestly don't believe it does that. I really don't. So if you're having back pain, do the free MRI review, get a real diagnosis, what's causing your pain. 87% chance it's a torn disc with inflammation, 87%. 8%, let's just say 10% is facet pain. Then there's sacroiliac joint pain and piriformis muscle pain. All right, that's 99% of chronic back pain. Nothing to do with epidural lipomatosis.
Lastly, we have one more question coming from Brad once
All right,
more
Brad.
on YouTube,
Uh-huh.
asking, why do some surgeons in India not utilize polyaxial screws, but instead just regular screws that don't have that swivel head on the
Yeah.
top of for rod attachment?
All right, great question. So, folks, what's being asked here is a really good question. I will try to see if I have a model I can show you. Yeah. All right. So the question is, in India, some surgeons will not use these type of screws. These are called polyaxial screws. What is a polyaxial screw? It's basically a screw that goes into the bone, and then the head of that screw, called the tulip, moves. You could rotate it around. The reason you do that is because in the old days, the screws did not have a polyaxial head. They had a fixed head. And when you put that screw in as a surgeon, you had to make sure all the screws lined up perfectly to get the rod to sit inside those screws. And I'm going to tell you something. I was trained in the days before polyaxial screws, but I was also trained on polyaxial screws. So I kind of was in training in the 97 to 2004. That was my training period at UF in Gainesville, top spine program. And we did both fixed head and polyaxial. I got to try both. The fixed are a pain in the butt to deal with in the operating room. They drag the case on, they make the case longer, they're much harder to do. The polyaxial screws were developed by Mickelson, an orthopedic surgeon, and he's a billionaire now. He has all the money in the world. Point is, he patented the idea, great idea. He was brilliant for doing it. I'm happy for him. It's made spine surgery so much better for doctors, surgeons, and patients. It's really helped to have the polyaxial screws. Why do they not use polyaxial screws in India? One simple reason: money. All right? Polyaxial screws cost a lot more money to buy, and the fixed head screws are cheap, very cheap. Nobody wants them. So they all end up in the places where, you know, you can buy it for a small amount of money, like maybe a a couple of $100. Whereas the polyaxial screws, these screws are $1,000 a piece. When they first came out, they were $3,000 a piece. Now they've come down in price to $1,000 each. So the fixed screws are probably $100. Polyaxial screws are still at best $800 a screw. So that's why, cost.
And that is it for questions.
All right, hope you enjoyed our surgery today. And for the patient who gets to watch all this after her surgery, you did great. I was very happy with the results. Everything went perfect.